Assalamualaikum and good morning to Madam Nur Razan. My name is Nofana binti Muhammad Fendi. So today my partner Wan Rozana and I will present about the abuse sexually. So this is all the overview that we will talk about, including introduction, sexual abuse introduction, sign of sexual abuse, the impact, the treatment and recovery, barriers to reporting and seeking help, preventive strategies and education, nursing diagnosis and intervention, example case, and also the conclusion. So abuse is a widespread social problem that cuts across all demographics, including age, gender, socioeconomic class, and cultural background. So it implies any deed or an inaction that purposely damage or jeopardize the welfare of another individual. Millions of people worldwide are impacted by abuse, which has a significant and frequently permanent effect on the physical, mental, and emotional well-being of survivors. So many cases are still underreported because of systemic hurdles, fear, or stigma, even with improved awareness and intervention efforts. So there are five types of abuse. The first one is technological abuse, which is the misuse of technology to harass, control, or intimidate someone, such as cyberstalking or monitoring online activity. Also, such as sharing intimate image without consent. Second is emotional abuse, which is the use of words, actions, of non-physical behaviors to manipulate, harm, or control another person emotionally, such as verbal insult or constant criticism. Next is sexual abuse, any non-consensual sexual act or behavior, including exploitation, such as rape and sexual assault. Next is physical abuse. It is an intentional use of physical force to harm or control another person, such as hitting or slapping. And the last one is financial abuse. It is a controlling or exploiting another person's financial resources for personal gain, such as stealing money or assets.
So, sexual abuse is a pervasive violation of an individual's rights and dignity, affecting millions worldwide, regardless of age, gender, socio-economic background. It includes a variety of actions such as coercion, harassment, exploitation, and inappropriate sexual contact. Sexual abuse fundamentally disrupts lives and relationships by causing severe emotional and psychological scars in addition to physical injury. According to statistics, 1 in 4 girls and 1 in 13 boys are sexually abused before the age of 18. This shows how common this problem is. Beyond childhood, adults also confront serious hazards, which are frequently made worse by underreporting, power relations, and social shame. So, presented here, there are four types of sexual abuse. The first one is contact abuse, which involves physical touching, penetrating, and forced contact. Second one is non-contact abuse, which involves exhibitionism or any behavior that exploits the victim sexually without direct contact. The third one is sexual exploitation, where there is a manipulation, coercion, or control of a person for sexual purposes, such as in pornography and prostitution. And fourth, child sexual abuse, which includes any sexual act performed with a minor, as well as grooming behaviors. So, presented here is are the dynamics of power and control in sexual abuse. First one is manipulation and coercion. Often, the abuser manipulate victims through threats, intimidation, or emotional control. Second one is the grooming behavior. Abusers often groom their victims by building trust or offering gifts to make their victim more compliant. Third one is victim blaming. Occur both within families and society, where victims are blamed for their abuse. Fourth one is power imbalance. The abuser typically holds some form of power over the victim. Key signs of sexual abuse. First one is the physical signs. So for physically, they tend to be bruises, abrasion or injuries around the genital area, thighs and buttocks. Or there may be sexually transmitted infection, pain or bleeding during urination or defecation. Also result in pregnancy in minors and difficulty walking or sitting due to injury or discomfort. For behavioral and psychological, Sometimes, actually, there is a sudden unusual fear of certain people or places, regressive behavior such as bedwetting, thumb sucking, fear of separation, withdrawal from social interactions, or extreme mood swing, and there's changes in personality, sexualized behaviors or knowledge, depression, anxiety or PTSD, self-harm, and suicidal ideation. For adults, signs of sexual abuse, such as difficulty with intimacy or trust others, PTSD symptoms such as nightmare, substance abuse, which they do to cope with the trauma, avoidance of certain people, places, and chronic health problems such as GI or gynecological issue that may not have clear physical explanation, suicidal thoughts. For child or adolescent, they may engage in appropriate sexual behavior or sexual knowledge. There is genital injuries, cruelty or dropping out of school, unexplained absences or changes in appearance, new fear or removing clothes, being alone at night or have nightmares, extreme agitation or angry outbursts. So shown here are the impacts of sexual abuse psychologically, physically, emotionally, and socially. First, we go through psychological impact. First one is post-traumatic stress disorder (PTSD), where the person may have a flashback, nightmares, or hypervigilance. Second one is low self-esteem, where the person may feel shame or often self-blame. Third one is suicidal ideation. Fourth one is depression and anxiety, where there's a feeling of hopelessness, fear, panic attacks. The fifth one is substance abuse, where they will do drugs and alcohol in order to cope with their emotion. So, for physical impact, um, first one is injuries, physical harm during the assault, such as bruises, fractures, or internal injuries. Chronic health condition, long-term physical effects like pelvic pain, gastrointestinal disorder or headache, sexually transmitted infection (STIs), where there's increased risk um, of HIV, HPV, and other infections, reproductive health issues, unintended pregnancies, due to complication or sexual dysfunction. For emotional and behavioral impact, um, emotional dysregulation, where there's a feeling of difficulty managing of emotion leading to anger, irritability, or emotional outbursts. Second one is avoidance behavior, where the person may avoid people, places, or situations that remind them of the abuse. Third one is difficulties in trust and intimacy, where there's a challenges in forming or maintaining relationship due to fear and mistrust. Fourth one is hypersexuality or asexuality, where some survivors may exhibit increased sexual behavior while others may avoid it entirely. Okay, for social impact. The first one is isolation. Survivors may withdraw from friends, family, or social activities due to stigma or fear of judgment. Second one is educational or work challenges, where there's a difficulty in focusing or staying productive at school or work. Third one is stigma and victim blaming, where the survivor often face societal judgment, which can hinder recovery. For the developmental impact in children and adolescents, um, for cognitive and academic delays, for academic, the first one is behavioral problem. Second one is cognitive and academic delays. There's a poor academic performance or delayed developmental milestone. For behavioral problem, the first one So the child may experience will exhibit aggression, self-harm, or risk-taking behavior. For the third one, attachment issue, um, the child may have difficulty forming healthy relationship with caregivers or peers. So now we'll move on to treatment and recovery. First one is cognitive behavioral therapy or CBT. This is a highly effective approach to treat PTSD and trauma in sexual assault victims, where it focuses on relationship between thoughts, feelings, and behavior, and it also helps them to identify and challenge distorted or unhelpful thoughts. Techniques that are used are cognitive restructuring, behavior activation, and exposure exercises. The patient will learn to replace negative thoughts with more positive and realistic ones, which can reduce feelings of guilt, shame, and anxiety, often associated with sexual assault. So, for trauma-focused cognitive behavioral therapy, TFCBT, is closely related to cognitive behavioral therapy (CBT), but this is specifically designed for kids and teens who are healing from trauma and their caregivers. This treatment allows caregivers to understand the trauma in general and how to help effectively. So for this CFCBT, uh, for isolation, for isolation, for trauma and narration and processing, survivors revisit and process the details of the sexual assault in a safe environment, learning to view their memories without fear. And then for stabilization, it focuses on coping with trauma and symptoms, teaching cognitive processing skills to address negative thoughts and beliefs. And for integration and consolidation, the survivor works with therapists to incorporate learned skills into daily life and develop future safety plans. Okay, for next treatment, this prolonged exposure therapy or PE. This activity, this treatment encourage survivors to confront trauma-related memories, feelings, and situations in control and safe environment, where it helps reduce power of trauma responses over time. It involves repeated detailed recounting of the traumatic event and gradual exposure to trauma reminders, both in vivo and imaginal, help process the trauma and reduce avoidance behavior. Next treatment is eye movement desensitization and reprocessing therapy (MDR). It's specialized to treat PTSD, uses bilateral stimulation to help process traumatic memories, example back and forth eye movement, touch or sound, and also helps to assess and process the traumatic memories without the need for extensive verbal discussion. Um, Also aims to reprocess these distressing memories, change how they are stored, and reducing their emotional impact. And the traumatic memories may become less vivid, and the associated emotions and physical sensation can diminish, lead the trauma less intense, and begin to heal.
Now let's talk about the barriers to report and seeking help. So there are 6 points. The first one is personal barriers. It includes fear of retaliation, where survivors may worry about physical harm, social backlash, or financial consequences from the perpetrator. Then, shame and guilt, where they internalize feelings of blame or embarrassment, often discourage survival from disclosing abuse. Lack of awareness, where some survivors may not recognize their experience as abuse, especially in cases of grooming or coercion. The last one is trauma response, such as PTSD or dissociation, can impact a survivor's ability to process the event and seeking help. So next is societal barriers. The first one is stigma and judgment, where they fear of being disbelieved or judged by friends, family, or community members, which then will silence the survivors. Cultural norms. So, in some cultures, discussing about sexual matters is taboo, discouraging open dialogue about abuse. And gender stereotype, where male survivors may face additional stigma due to societal expectation around masculinity. Next is pre-parental dynamics. So the first one is a relationship with a pre-parental, where abuse by family members, partners, or trusted individuals will create a conflict of loyalty and fear of disrupting relationships. Next is power imbalance, where pre-parental imposition of authority, such as employees or teachers, may exploit their influence to silence the survivors. The fourth one is media and public perception. It is first sensationalism, where the media coverage of abuse cases can deter survivors by exposing them to public scrutiny, and then victim blaming, where societal tendencies to question the survivors' credibility or actions perpetuate the silence. Next is systemic barriers. So, distrust in authorities, where the survivors may lack confidence in the police, legal, or healthcare systems, where they fear mishandling of their cases. Limited resources, such as people who stay in rural or underserved areas, may lack accessible services such as crisis center or specialized counseling. Uh, Legal challenge, where they fear of invasive investigations, lengthy court process, or weak legal protection, can deter reporting. And the last one is language and accessibility. So non so non-native speakers or individuals with disabilities may face difficulties in communicating their needs or accessing support. And last one is lack of support. So negative first response, which is a dismissive or skeptical reaction from the first person a survivor confides in, can prevent further attempts to seek help. And then isolation. So survivors without supportive networks may feel they have no one to confide in. So they tend to isolate themselves and be alone a lot of time. So this is the preventive strategies and education. The first one we go to for education and awareness. So it can be school-based programs where it implement age appropriate education in schools to teach our children about body safety, consent, and recognizing inappropriate behavior, such as program like Good Touch, Bad Touch, or Safe Environment Education. Next is parental education. So educate parents about warning signs, communication technique, and creating open dialogue with children. And the last is community workshops. It provides resources and training on sexual abuse prevention in community centers, workplace, and religious institutions. Second is empowering children and adolescents about sexual abuse. So body autonomy training, where they teach children that they have the right to say no to the unwanted touch, even from familiar people. Consent education, where they explain the importance of mutual consent in relationships, especially to teens, as part of comprehensive sexual education. And next is digital safety, where we can educate young people about online dangers such as grooming, cyberbullying, and sextortion. Third, training for professionals, for teacher or school staff training, where equip educators to recognize signs of abuse and understanding the mandatory reporting protocols. Healthcare provider training, where they can train medical staff to identify and respond sensitively to potential abuse cases. And the last one is, of course, law enforcement sensitivity training, where they need to ensure police officers to handle cases with care to minimize re-traumatization of the survivors. Four is societal and community initiative. First can be public awareness campaign, which they can use media to raise awareness about sexual abuse. So it can happen to anyone, and challenging moods like victim blaming. Support hotline and resources. So there is widely publicized resources like the National Sexual Assault Hotline at 1-800-656-HOPE, and online platforms like RAINN. And the next is community surveillance. So this is to encourage communities to watch for and report any suspicious behavior or potential abuse that they look. Next is the last one is legal and policy reforms, including a stronger law and enforcement, where they can advocate for stricter penalties for offenders and better protective law for survivors. So mandatory reporting, so they need require professionals working with children to report suspected abuse that happen or surrounding them. And last one is improve a vetting process. So strengthen background checks for individuals working with vulnerable population. So these are several of the diagnoses that related for sexual abuse. The first one is post-trauma syndrome related to experiencing sexual abuse. Second, acute pain related to physical injuries or trauma. Third, risk for infection related to exposure to bodily fluids to mucous membranes and skin. Four, effective coping related to emotional overwhelm or lack of support from surrounding. 5. Risk for self-harm related to feelings or shame or hopelessness. 6. Anxiety related to fear or further harm or societal judgment. 7. Chronic low self-esteem related to negative belief about self-worth following the abuse. And last one is disturbed sleep pattern related to nightmares or fear of sleeping alone. So this is the general nursing interventions that nurses can done to the victims of uh, sexual abuse. The first one, perform a comprehensive physical examination to identify any lacerations, bruises, or other trauma. This is to documenting injuries for medical and legal purpose and address any immediate physical health needs. This is also to ensure that there are no injuries are overlooked, especially those requiring urgent care. Second, explain medical procedure, the purpose of evidence collection, and the availability of prophylactic treatments for sexual transmitted infection and pregnancy to build trust and reduce anxiety and empowering the survivor to make informed decisions about their care. Third, administer prophylactic treatments for STI and offer post-exposure prophylaxis for HIV if indicated. This is to reduce the risk of developing infections and provide reassurance about managing potential health risks or chronic low self-esteem. 4. Provide a non-judgmental, empathetic, and private space to help the survivor to feel more safe. So this can help survivor to feel more secure and supported. 5. Reassure the survivor that the abuse is not their fault and their feelings are valid to avoid chronic low self-esteem. So this to help counter feelings of guilt or self-blame which are common among survivors, and this will help support long-term emotional recovery. 6. Offer immediate emotional support to manage shock, anxiety or distress from the victim. So survivors may experience intense emotional reactions. So timely support will stabilize them and prevent any worsening of their mental health. 7. Listen to survivor when they share their story at their own pace without pressing for details they are not ready to disclose. So this is to prevent them from getting anxiety and respect their boundaries and minimize the risk of re-traumatization. 8. Respect the survivor's autonomy in decision making about care and reporting. This is to make empower the survivors to make decisions to restore a sense of control, which is often lost during traumatic experience. 9. Minimize invasive procedure or actions to avoid trigger memories of abuse. This is to minimize the risk of exacerbating trauma or causing additional psychological harm. And the last one, 10, is engage in advocacy by promoting public awareness, supporting policy changes, and ensuring the availability of resources to survivors. So this is to help address any systematic issues, raises awareness, and ensure the survivors have access to the support and resources they need for the recovery. So this is one of the example case of sexual abuse where a man, Idaho man, sentenced to 20 years for impregnating girlfriend's child twice and bring her across state lines to avoid charges. And this case happened in November 2023. So this is about Chris Humber was sentenced by senior U.S. District Judge Bill Lynn Windmill to the maximum sentence of 240 months or 20 years. So these are the summary of chronology for these cases, where Hamburg actually began dating the child's mother in the early 1990s, and moving in with her family. So he started to abuse the child sexually at the age of 10. So by the time Hamburg has gotten this child pregnant by the time she only was 11 years old. And after she was giving birth, Amber bring this child to another state and continues continually sexual abuse her. So at the age of 13, she got impregnated again. So this abuse continued until the victim was in her early 20s. So in 2021, she reported Humbers to the FBI and the Boys Police Department. So after the investigation, U.S. District Judge Billy Windmill sentenced Humber to 20 years in federal prison for transporting a child across state lines with the intention of sexually abusing her. So, for career conclusion, sexual abuse is a profound violation of personal boundaries with far-reaching and multifaceted effects on individuals and society. Its prevalence across all demographics underscores the need for vigilance, awareness, and prevention. So, the survivors often face enduring psychological, physical, and social challenges, including trauma, health issues, and difficulty in forming healthy relationships. Holistic interventions combining awareness, support, and systemic change are essential to mitigating the impact of sexual abuse and fostering a resilience in survivors. So these are all the preference for our presentation today. So that's all from us. Thank you.